I break down the body contouring in several categories to make it easier for the patients when I explain it to them during consultation. So there will be non-invasive body contouring, minimally invasive body contouring, and then of course fully invasive surgical body contouring. So non-invasive procedures are the ones we can do in the office using machines such as radiofrequency. I have a full complement of machines that do skin tightening, fat melting, and muscle tightening with in-mode technology, which uses radiofrequency. It would be Forma, Body Effects, Evolve Tight, Evolve Trim, and Evolve Tone. It's really good to get small pockets of fat, tighten the skin when we get that kind of wrinkling and saggy skin from childbirth, or maybe on the thighs, a very common area to treat where skin starts to sag. On your arms, we can use those non-invasive modalities. Obviously there'll be no downtime with those, but the downside of all those machines is that you do have to do repetitive treatments, usually a set of 8 once a week. For most of them, muscle tightening, we usually do a set of 4. So it just depends on your time and your ability to come into the office to do those treatments. But again, there's no downtime from them, and results are good for those who qualify for the procedure. Now, minimally invasive body contouring is basically your liposuction. Liposuction with all the other additional procedures we can add to it to tighten the skin, to break down the fat, to reposition the fat. We can use body tight, radiofrequency assisted liposuction for skin tightening. We can add Vaser, which basically breaks down the fat to tiny little particles. That way when we do transfer that fat to another area, the fat grows better, it sticks better, it does not melt away as much as with regular standard fat transfers. And of course we can transfer fat to the breast, we can transfer fat to the butt. A lot of times I end up transferring fat to the areas of previous liposuction if patients came from somewhere else, and sometimes they get those ridges, especially if that liposuction that was done without Vaser and without those electronic tools. Those uneven areas, sometimes we'll take fat from somewhere to try to fix those areas for patients as well. So kind of doing like a redo body contouring liposuction procedures. And then fully invasive body contouring, that would be your tummy tucks, breast lifts, breast reductions. It could be done in combination with your liposuction and minimally invasive procedures. So we can do liposuction of certain areas, tummy tuck or mini tummy tuck of the belly with muscle repair. If there was a hernia, I can repair it at the same time. So I would combine all those modalities at the same time. We can add thigh lifts and arm lifts, and depends again on number of areas, on the size of the person. We can decide, can it all be done in one day? Should it be broken down into multiple procedures? Again, based on your live, based on your health, based on your overall outcomes, and so on. For non-invasive procedures, we have pricing that will go per area. Pricing on liposuction and body sculpting, the minimally invasive body sculpting. Again, depends what we're trying to achieve, how many areas we're treating. Sometimes I'll give a full kind of like one body sculpting liposuction 360, which would involve basically liposuctioning all of the areas of the trunk, belly, back, lower back, potentially repositioning fat into your butt. And if I need to do like a mini tummy tuck to get rid of that extra roll down the bottom of your belly, if I need to do it, but it's gonna be like one price, includes all. And some people choose to do that because it's easier for them to say, just reshape this. And those prices can start at about $20,000. Now, if we start kind of picking little areas, you know, fix a little here, fix a little there, of course, price will be completely different. And then for invasive procedures, usually we do, you know, tummy tuck has one price. If I have to do tummy tuck with liposuction, that will be a slightly different price. People often ask, what is Mami Makeover? So Mami Makeover, in my mind, is basically a set of procedures: breast procedure, because a lot of times after pregnancy, breasts may become more saggy, maybe flatter, right? We'll lose that upper pole fullness. We want to replace it with maybe implant. Tummy, whether it's liposuction, whether it's tummy tuck, could be your second area. And then a lot of times I will include vaginal rejuvenation of some sort, femtite, IVIVA procedure, labiaplasty, or vaginal rejuvenation with fixed and urinary incontinence issues. Again, all of those issues can be addressed during mommy makeover procedure. And when we run specials on mommy makeover, basically it means we'll combine a set of those procedures that will apply to you and potentially get a discount for a package deal.